In fiscal year 2021, through the Substance Abuse Prevention and Treatment Block Grant Program COVID-19 Supplemental Awards, the Ohio Department of Mental Health and Addiction Services, Ohio University's Voinovich School of Leadership and Public Service, and the Pacific Institute for Research and Evaluation came together to provide support to 5 urban behavioral health boards in Ohio as they engaged in community-based processes to address the impact of social determinants of health when planning for substance use disorder prevention and mental health promotion services and programming. This Community Collective Impact Model for Change 2.0, addressing social determinants of health in minority and underserved communities, was unique because the urban behavioral health boards received phased funding. Project directors began Phase 1 by working to bring together people and groups who had lived experience with health disparities and social determinants of health. Collaboratively and iteratively, community work groups created a data-driven impact statement in Phase 2. From this impact statement, work groups then created 3-year prevention services plans, detailing the goals, objectives, and action steps to be taken to address a specific social determinant of health within an identified priority population as the final initiative phase. The series of videos that follow were created by the communities for the communities and highlight the 3 phases of this initiative through photo voice, ethical photography for social change.
I think that there is power in numbers, and I feel like when we are trying to tackle a large issue such as social determinants of health, it's a systemic issue, and we know that there are power in numbers. We know that people want to have their voice heard, and that the more people involved in this effort, the more that the community can become aware of what it is that needs to be changed.
Thank you. So Hamilton County is a large community, it's very diverse. We are very research rich in terms of different things that fall under social determinants of health. We have a healthcare system that's huge, and a number of the hospitals are just world known. We have Fortune 500 companies that reflect economic stability. We have, a number of neighborhoods who have great parks. So we just have many resources here. Everyone doesn't have access to it. And because they don't have access to it, the outcomes for them are not as great.
Public health and law enforcement, all working together to connect the dots and advocate collectively.
We also feel like an impact statement gives us a greater, clearer sense of what we want to achieve. Our impact statement was around the generational impact of social determinants of health on Black and Latino males in our community. But some of our initial data says to us that we need to address the needs of Black and Latino males across the lifespan. We have, again, said we did this because we had some initial data from various needs assessments being conducted in our community, things that were not going well for males in the community, Black and Latino males, and hear from them, their voices.
Downtown Cincinnati, 13th and Walnut. I went to St. Francis School, and I've seen a lot of drug use, a lot of substance use, and so that just wanted me to just be better.
So we have in our community a number of coalitions for addressing various issues from suicide to the opioid epidemic.
The place that impacted me the most is downtown Main Street. My family were considered a bad group of people.
The place I would like to talk about today is the Center for Addiction Treatment, struggling with drug and alcohol addiction. Today, I'm a peer supporter there. I just recently got a promotion to case management outpatient services, and it helped me become a pillar in my community.
So Sue, why do you think people in Hamilton County feel it's important to address social determinants of health?
With health, we're not on a level playing field. There are people in this county who are really hurting, and they have food insecurity. They don't have access to health care like other people do. And we really need to work upstream, like we say a lot, with social determinants of health to make sure that they do have access. They do have their basic needs met. And that's very important.
The work we've just seen was guided in part by the CDC resource titled Promoting Health Equity, a resource to help communities address social determinants of health, which describes how considering the impact of social determinants of health when planning for prevention services can improve health outcomes and promote health equity across the lifespan. Additionally, the Ohio University and PIRE teams provided training, technical assistance, professional development, and networking opportunities. The results represent a truly community-led initiative focused on actualizing the impact statements to work towards health equity in each community.